At the Artemis practice, we will see patients in the office throughout their pregnancy, and you'll try to meet all of the providers who are in the office throughout the pregnancy just so that you know everyone and they're all familiar, so that when you go into labor, whoever is on call for the hospital service or for the birth center service, depending on where you're planning on giving birth, will hopefully be a face that you've seen before. And everyone has, the same access to all of the pregnancy information and health history for that person. When you do go into labor, and you end up going to the hospital, one of the Artemis midwives or providers who's on call for that day will either call the hospital to check in and see that you got there okay and are settled in and that labor is going well, or come and meet you there if they're able to help you settle in. And then the births will, in almost every circumstance, be attended by one of the providers from the Artemis practice, whether it's a midwife or a physician. There are also hospitalists that are available at the hospital, so that if there was an emergency or someone came in unexpectedly, or for whatever reason someone went there without calling or something wild happened, there's a physician who's there on site 24/7 who would be able to help bridge the gap while a provider is making their way over, since we're an on-call practice. But the goal is always that one of the Artemis providers will be there with you throughout the birth, and someone from the Artemis practice will come and visit at least once a day during the postpartum time period as well, until you go home. And then all of the postpartum care, of course, will be back at the Artemis office. On the birth center side, it's pretty similar, right? So you'll try to meet as many of the providers as you can in the office throughout your pregnancy. For the birth center, we do also have some community midwives who don't attend visits in the office, and a great time to meet them is at the open houses. And then when you come in labor, again, someone will come and meet you, but there isn't someone 24/7 at the birth center. It's a much smaller practice. We have a lot fewer babies over here than an entire hospital would, right? And so you'll call ahead of time and the midwife will come and meet you here with a nurse. And then all of your follow-up care still will be on the Artemis side.